Oh, it looks like somebody fell on their mountain bike over there. Should probably go over and help. But before I go over and help, I want to make sure the scene is safe. So I don't see any other bikers on the trail. That's a good sign. I'm looking around. I don't see any other hazards, so the scene is safe. It looks like maybe there's a big hill. Maybe they were just going too fast and crashed and fell over their bike. I should take body substance isolation precaution. So I'm going to go ahead and put my gloves on here real quick. And I have other PPE in my backpack if I need. I have glasses and a raincoat in case I need that. I only see one patient. Let me just double check. Okay, I only have the one patient. And they appear to be awake. They look like they're moving around, which is a good sign. But they definitely look to be hurt. So I'm going to go head over and see if I can get consent to treat. Hey, can you hear me?
Yeah.
Hey, my name is Kendall. I have wilderness first aid training. Can I help you out?
Yeah.
Okay, great. What's your name?
Annie.
Annie, great. I'm just gonna go ahead and hold your head here just to remind you to keep your head still. Would that be all right?
Yeah.
Okay, great. Okay, Annie, I'd like to just do a quick initial assessment. Would that be all right with you?
Yeah.
Okay, great. Can you go ahead and open your mouth for me? I just want to look inside. Do you feel like you have any broken teeth? Did you chip a tooth? Were you chewing on any gum or food when you crashed? Anything like that?
No.
Taste any blood?
No.
Okay, great. Can you take a deep breath for me? Okay, great. Can you take one more deep breath? All right, great. Do you have any pain with that or do you have any trouble breathing?
No.
Okay, great. Can I check your circulation? Would it be all right if I feel the pulse on your hand right here?
Yeah.
Okay, great. Great, you have a good strong pulse. All right, Annie, do you feel like you're bleeding anywhere? Do you feel any wet spots?
I don't think so.
Okay, great. Would it be all right if I checked, if I just went ahead and ran my gloved hands down your body just to make sure you're not bleeding anywhere?
Yeah.
Okay, great. Annie, I'm gonna let go of your head. I want you to stay really still for me. Would that be all right?
Yeah.
Great. I'm just gonna reach over you for a second. Okay, you're not bleeding anywhere, so that's good. So can you go ahead and just tell me what happened?
Yeah, I was riding my mountain bike down that hill over there and I went a little bit too fast and I crashed and fell over my bike.
Okay, when you fell, how did you land?
I landed on my shoulder.
Landed on your shoulder, okay. And were you wearing a helmet when you fell?
Yeah.
Okay, great. And oh, great, I see your helmet over there. Everything looks intact there, so that's good. All right, Annie, since you had a high-speed crash, I want to continue maintaining stabilization of your spine, but I want to do other assessments. And since it's just me here, I'd like to go ahead and take my backpack and your backpack, if that's okay, and place it around your head. That way it can help keep your head in line. Would that be all right with you?
Yeah.
All right, I'm going to let go. Just stay super still for me. All right, is that okay?
Yeah.
Okay, great. We're just going to step on this side and use your backpack. Okay, Annie, is that okay?
Yeah.
Okay, great. So what's bothering you the most right now?
Definitely my shoulder.
Your shoulder. Can you point to it for me where it's bothering you? Right over there, great. Now, I'd like to check on the skin level. Would that be all right real quick?
Yeah.
Okay. I'm just gonna move your jacket here just for a second. Okay, I definitely do see an injury to your left clavicle area. All right, Annie, now that we've done an initial assessment, I'd like to go ahead and do a full head to toe exam. It's exactly what it sounds like. I'll start at the top of your head, and I'll go down to your feet. And I'm just gonna feel around and make sure you didn't injure anything else. Would that be all right with you?
Yeah.
Okay, Annie, so like I said, I'm just gonna start at your head here and feel around, see if you have any pain. That'd be okay?
Yeah.
Do you have any pain here?
No.
Okay, I'm gonna look in and behind your ears, so I'm just gonna lean over you for a second, if that's all right. Okay, I don't see anything in or behind your ears. Check this side. Okay, this side looks good. Go ahead and just bite down on your jaw for me, clench real tight. Any pain with that?
No.
Okay, great. And just look at your neck. Okay, everything's symmetrical. Now, I don't see a medical necklace. Do you wear a medical necklace, maybe on your neck, your feet, or your hands?
No.
Okay, great. I'm just gonna feel on your shoulder. I know that side kind of hurts, but I'd like to do a press. Would that be all right?
Yeah.
All right. I'm gonna lean over you.
Ooh.
Is that okay? Ooh, a little tender. Okay. How about this side? Is this side okay?
That side's all right.
Okay. I'm gonna feel the collarbone on this side. Any pain here?
No.
Okay. What about on this side? I'm just gonna move your jacket.
That does not feel good.
Doesn't feel good? Okay. Painful on that side. Sorry about that. Would it be alright if I go ahead and just feel your ribs while you take a breath?
Yeah.
So I'm gonna put my arms around you, that'd be okay?
Mm-hmm.
Alright, go ahead and take a deep breath for me. Okay, great. And take one more for me. Alright, ribs are moving together. Do you have any pain with that?
No.
Okay, great. Can you point to your belly button for me? Okay, great. I'm gonna feel on your stomach and press. Just let me know if you have any pain, okay?
All right.
Any pain?
No.
Okay, I'm gonna go ahead and press on your hips.
Oof.
But you have some pain? Where'd you have pain?
My left hip.
Your left hip? Okay, let me go over and check. Would it be okay if I get to skin level? I'm just gonna move your jacket and your pants a little bit.
Yeah.
Okay, you have a bit of a bruise there. Other than the bruise on your hip, do you have any other pain in your hip?
No.
Okay, great. I'm gonna come back over here. All right, I'm just gonna feel down your legs. Let me know if anything hurts. Do you have any pain?
No.
Can you bend this knee? Okay, great. Just gonna reach over and do this other leg. Any pain?
No.
Can you bend this knee? Okay, great. Put your leg right down. All right, Annie, I'm just gonna feel in your shoes. Your feet feel nice and warm. Do they feel warm to you?
Yeah.
Okay, great. Without looking, can you tell me where I'm touching right now?
It's my big toe.
On what side?
My right side.
Great. And how about now?
My pinky toe.
What side?
My left side.
Great. And can you go ahead and just press down for me? Great. And can you go ahead and pull up for me? Okay, great. Do you have any numbness, tingling, pins and needles, hot, cold sensations in your feet?
No.
Okay, great. All right, Annie, I'm just gonna check out your arms real quick. You have any pain?
No.
Can you bend that elbow? Great. I'm just gonna reach over and grab your other arm. Do you have any pain?
Yeah, that hurts.
A little pain? Okay, let me come over and check. Would it be all right if I moved your jacket?
Yeah.
Great. Okay. I see some abrasions, some cuts and scrapes on that side, so I'll be gentle with that side. Let me come back over here. Can you put your arms on your stomach for me? Okay, great. Without looking, can you tell me where I'm touching?
My thumb.
On what side?
My left side.
Great. And how about over here?
My pinky.
What side?
My right side.
Great. Can you do jazz hands for me? Great. Can you just give me a squeeze? Okay, I'm just gonna check your pulse on both sides. Good, nice strong pulse on both sides. Do you have any numbness, tingling, hot, cold sensations, pins, needles in your hands?
No.
Okay, great. Okay, Annie, so what I'd like to do now is I'd like to check your back. So I understand your left shoulder and your left hip are kind of bothering you, so I'm gonna roll you up this side. So what I'm gonna do is I'm gonna move my backpack in just a second. I'll put my hand under your head. I'll kind of grab by your hip and I'll roll you up towards me. I'll check your back and then I'll roll you back. Would that be okay with you?
Yeah.
Okay, great. So just stay super still for me. Can you raise your right hand, this hand right here, like you have a question in school? Great. I'm gonna put my hand underneath your head here. Is this okay?
Yeah.
Okay, great. And now would you be able to kind of give yourself a hug with that side? Does that hurt your shoulder too much?
No, it's fine.
Okay, great. I'm gonna grab a handful of your clothes down by your hip and roll you towards me. It'd be great if you could go ahead and tighten your core for me when I tell you to. Would that be all right?
Yeah.
Okay, great. Go ahead and tighten your core, then I'm gonna roll you on 3. Ready? 1, 2, 3. Great. I'm just gonna feel up and down your spine. Am I still on your spine?
Mm-hmm.
Great. Would it be all right if I go underneath your fleece here?
Yeah.
Great. All right. Do you have any pain?
No.
Okay. How about on the sides? Any pain here?
No.
How about on the side?
No.
Okay, great. So, Annie, on 3, I'm gonna go ahead and roll you back. Ready? 1, 2, 3. All right, great. You go ahead and put that arm down. I'm gonna move my backpack here. All right. Okay, Annie, now that we've done full assessment, I'd like to go ahead and get some vital signs. Would that be okay?
Yeah.
Okay, let me just note the time real quick. Alright, and for the, how old are you?
I'm 22.
You're 22. For the purposes of my documentation and medical purposes, what is your sex?
I'm a female.
Female. Okay, can you give me your full name?
Annie Toothaker.
Okay, great. And can you tell me where we are right now?
We are at a mountain bike park in Dresden, Maine.
Okay, great. And can you tell me roughly what time of day it is right now?
It's like 2 o'clock.
Okay, great. And can you tell me what happened?
I don't really remember, but I was biking and I fell over the top.
Okay, great. Alright, so I'm going to check your heart rate. Would it be okay? I'm going to just put my hand on your pulse. Would that be alright with you?
Yeah.
Okay, great. Okay, great. Just breathe normally. Okay, great. Thanks, Annie. You just put your hand right there. All right, next, Annie, I'm just going to go ahead and check your respiratory rate. Would that be all right?
Yeah.
You can just breathe normally. Okay, great. Thanks, Annie. All right, I want to check your skin color, temperature, and moisture. So can you just roll down your lip just like I did for me? I'll check the color. Okay, great. Thanks. And I just want to feel right underneath your collarbone. Would that be okay on your skin level?
Yeah.
Okay, great. Thanks. Okay. I don't have a blood pressure cuff, but I'm going to go ahead and check your pulses. Good, strong radial pulse on both sides. That's great. All right, and I'd like to check your pupils. So could you go ahead and close your eyes for me? Okay, great, Annie. And on the count of 3, can you go ahead and open your eyes? Ready? 1, 2, 3. Open your eyes. Great, thank you. Pupils are pearl. All right, and we don't have a temperature, so we're not going to do that. Okay, Annie, I'd like to ask you some questions. Would that be all right?
Yeah.
All right, so what's bothering you the most right now, today?
Definitely my left shoulder.
The left cleft, all right. Other than that left shoulder area, do you have any other symptoms, anything else bothering you?
I feel a little dizzy.
You feel a little dizzy, okay. Do you feel nauseous, or do you have a headache, anything like that?
No.
Okay. Anything else bothering you?
No.
Okay. Allergies. Are you allergic to anything in the environment, insects, animals, any foods, medications, anything like that?
No.
No? Okay. What about medication? Do you take any medication daily?
No.
Do you take any over-the-counter medication today?
No, I did not.
Is there a medication you're prescribed that you should be taking that maybe you're not taking?
No.
Okay. And then do you take any herbal supplements, vitamins, anything like that?
No.
Okay. What about any past medical history? Do you have a history of seizures, cardiac issues, anything like that?
I don't have any of those, but I have diabetes.
You have diabetes. Okay. Are you type 1 or type 2?
Type 2.
Is there anything else that you see a doctor for regularly? Anything else that you think of?
No.
What about to eat or drink today? How much have you had to eat or drink today?
I haven't had much. I had like a little snack before I got biking, but other than that, not much.
What about water? Have you been drinking water throughout the day while you've been biking?
I've been drinking plenty of water.
Just not much food.
No.
What about bowel movements, urination? Any issues with that today?
No, none of that.
Okay, great. And can you tell me one more time what happened?
I was biking and I went over the top of my bike.
All right, thanks, Annie. Okay, Annie, now that we've done some vital signs and a history, I'd like to go ahead and do a focused spine assessment because of the wilderness context we're in, and we're most likely going to have to walk out of here. I'd like to go ahead and just do another assessment to see if I can go ahead and move these backpacks and get you seated up in a more comfortable position. Would that be all right with you?
Yeah.
Okay, great. So I'm going to check some things out and I'm going to ask you some questions, and some of this is I'm going to be repeating myself, and I know it's repetitive, and I'm sorry about that, but just go ahead and bear with me if you will. All right, so first I'm going to ask you, what's your name?
Annie Toothaker.
Okay, great. Where are you right now?
I'm at the mountain bike trail in Dresden, Maine.
Okay, great. And what time of day is it?
It's around 2 p.m.
Perfect. And what happened before I got here?
I fell while riding my mountain bike.
Okay, great. Okay, Annie, have you had anything to drink today, alcoholic beverages, anything like that?
No.
Okay, great. Have you taken any medications today?
No.
How about recreational drugs?
No.
Okay, great. So you've taken nothing today, completely sober?
Yep.
Okay, great. All right, Annie, I'd like to go ahead and check your hands and your feet again, if that's all right?
Yeah.
All right, I'm gonna go to start your feet. I'm just gonna feel in your shoes, okay? Your feet feel nice and warm. Did they feel warm to you?
Yeah.
Okay, great. Without looking, can you just tell me where I'm touching?
My big toe.
What side?
My right.
Great. And what about now?
My pinky on my left side.
Okay, great. Can you go ahead and push down on my hands? Go ahead and pull up. Okay, great. Wiggle your toes. Okay, great. Do you have any numbness, tingling, hot, cold sensations, anything like that on your feet?
No.
Okay, great. All right, you can go ahead and just put your hands on your belly for me. Okay, you're gonna feel your hands again. Now without looking, can you tell me where I'm touching?
My pinky on my left hand.
Great. And how about now?
My thumb on my right hand.
Great. Can you go ahead and do jazz hands for me? Great. Give me a good squeeze. Great. I'm just gonna feel your pulses. Okay, good, strong radial pulse. Do you have any numbness, tingling, hot, cold sensations, anything like that in your fingers or your hands?
No.
Okay, great. All right, so like I said, Annie, I want to check your back one more time. So what I'm going to do is, just like before, I'm going to move my backpack. We'll go ahead and roll you up. I'll check your back, and then I'll roll you back down. Is that okay?
Yep.
Okay, great. So you can go ahead and raise your hand, just like you're in school, if you want to raise this hand for me. Yep, great. I'm just going to put my hand underneath here. Great. Is that okay?
Mm-hmm.
Great. And if you can give yourself a hug, is that okay on your shoulder?
Yeah, that's fine.
Okay, great. And if you just want to cross this leg over, great. And then, like I said, last time, if you go ahead and just tighten your core when I tell you to, that'd be great. And then I'll go ahead and roll you. So go ahead and tighten your core. All right, ready? 1, 2, 3. Okay, great. I'm just going to feel up and down your spine, just like last time. Is it okay if I go underneath your shirt?
Yeah.
Okay. Am I on your spine still?
Yeah.
Great. Any pain?
No.
Okay. How about on the sides?
No.
How about here?
No.
Okay, great. I'm going to roll you back down on 3. Ready? 1, 2, 3. Okay. You can go ahead and put that arm down, whatever position's comfortable for you. I'm going to put my backpack back. All right, is that okay?
Yeah.
All right, you can go ahead and put your feet in whatever way is comfortable now. All right, Annie. So now that we've done a full patient assessment, and we've done vital signs and a history, and we've done a focused spine assessment, I feel comfortable letting you sit up to a position of comfort and moving these backpacks out of the way. Does that feel okay to you?
Yeah.
Okay, great. So let's go ahead and do that. All right, now that we've done a full patient assessment, Again, it said vital signs, done a history, and done an FSA. We're going to go ahead and call in a radio report. So this is Kendall Gemilaro with an evac request. We are currently located at the mountain bike park in Dresden, Maine. I have a 22-year-old female patient whose chief complaint is left clavicle pain. The cause of this pain is a mountain bike crash. The patient is ANO ×3. The patient has abrasions on their left elbow and upper arm, bruising on their left hip, and a deformity in their left clavicle shoulder area. Excuse me. The patient is also dizzy. The vital signs are ANO ×3. Heart rate is 80, strong and regular. Respiratory rate is 20, regular and unlabored. Skin color, temperature, and moisture is pink, warm, and sweaty. BP we were not able to take because we don't have a blood pressure cuff, but we got a good radial pulse on both sides. Pupils were pearl. Temperature we did not take. We don't have a thermometer. Our sample history includes the patient is a type 2 diabetic. We suspect the patient has an injured left clavicle and is feeling dizzy due to low blood sugar. Our treatment is to give the patient a sugary snack, sling and swathe their left shoulder, and monitor vital signs and CSMs, and walk the patient to the trailhead, and we request EMS to meet us at the trailhead.